Make no mistake about it, mental health and substance use are disease states. It's important to recognize that and treat them as such, as opposed to some sort of weakness of personality.
Todd Salceder with North Point Recovery says in the last 2 years, he's seen a huge increase in anxiety and depression, which can lead to issues with addiction. As people get together for the holidays, he says it's important to notice and acknowledge those habits.
There can be a variety of things. Oftentimes, if alcoholism has progressed into a pretty severe form where they're not openly drinking in front of other people, there are certainly people who drink so much openly in front of others, it's obviously an issue. But for some people, it progresses into more of a private disease.
Salceder says there are a few signs to take note of, like someone who's more intoxicated than they should be after 1 or 2 drinks, or someone who just tends to spend more time isolated at group functions.
If they look like they're overwhelmed emotionally, but seem to constantly be having a new drink and become calmer throughout the evening, they're probably drinking to manage that emotion.
To have a conversation with someone about this, Salceder says it depends on your relationship level.
When people have diseases of mental health and diseases of addiction, they want others to not notice it. There's time spent trying to make others not notice it. And so if you notice it and don't have a close relationship, they may take offense or get very defensive. It's very important that you always approach it not as a, hey, you are doing this and you shouldn't be doing this, but as, look, we all care about you, or I care about you very much, and it concerns me what I'm seeing, and I just want to make sure you're okay.
While this may be an issue someone feels they need to take care of right away, Salceder says the holidays may not be the most appropriate time to confront them.
Unless it's something that's obviously blatantly dangerous, i.e. they're highly intoxicated and they're going to get in a car and drive.
He adds it's important to engage with people who are suffering from these mental health issues.
Sometimes there's a fear that if we invite, our uncle who's in recovery for alcoholism, or our cousin who has social anxiety, that we're causing them more distress and we're going to cause them to feel overwhelmed. And the exact opposite of that is true.